Mr. Barton.
Thank you, Mr. Chairman. Appreciate you recognizing me. Today we're going to consider a number of bills, the most important and controversial of which is the Family Smoking Prevention and Tobacco Control Act, which is a bill that you have personally introduced for a number of Congresses. Regarding that particular bill, I will say today what I said during last year's markup of what is basically the same bill. The FDA is the wrong agency at the wrong time to give this type of responsibility. As we all know, the FDA's primary responsibility is ensuring the safety of our drugs and our food in the United States. It approves food, drugs, and medical devices based on safety and efficacy. This legislation would give the FDA a new job, require it to take on something that is both enormous, completely outside its regulatory experience, and I think will divert attention from its core mission. Since last year's markup, as you very well know, we have witnessed salmonella outbreaks in both peanut butter and peppers. We've heard criticism from both sides of the aisle. The FDA is not adequately staffed to handle its current responsibilities. Several members of Congress have gone so far as introducing legislation to split the FDA into two separate agencies because they claim the agency is not placing the appropriate attention on food safety. A previous commissioner of the FDA, in testimony provided to this committee, stated that the agency, that is the FDA, is not the proper place for this type of responsibility, and that placing this type of regulatory authority at the FDA will divert resources from other critical areas. That seems to be, to my opinion, self-evident. There are better ways to address the issue of tobacco, and I would hope as the bill moves forward, members will reflect on the unintended consequences. Mr. Bouyer is going to offer what amounts to an amendment in the nature of a substitute, and I think it is worthy of some consideration. I'm also disappointed about the process on this particular bill. I know that it passed the House in a form very similar to this last year on the suspension calendar, and I will admit that it's probably going to do so again this year. But we have a number of new members on the committee, especially on the majority side of the aisle, and I'm not aware of any special deadline or pressing reason to bypass regular order, which would and should include a hearing and perhaps even, wonder of wonders, a subcommittee markup. Lots of people are beginning to talk about the good old days when we actually had regular order, and I think there's some value in going back to it. The absence of regular order does a disservice to the members of the committee, especially the new members of the committee, and the people that they represent, because they've not had a chance to review the issues like some of the grizzled veterans like yourself and myself. Now, a few words about the 9 public health bills. First, the good news. They are bipartisan. I think a third of the bills are offered primarily by minority members, and I appreciate you, Mr. Chairman, for including those bills in the markup. It's a good thing when we work in a bipartisan manner. So I will say, though, that some of the bills that we're considering today, while they have passed the committee in similar form, have been changed, and I believe the bills that have been changed, it would have been nice to have had a hearing at subcommittee so we could get an idea of the consequences of those changes. We have been working at the staff level to resolve some of the issues that have been addressed, have been brought up because the bills have been changed, and I will say, Mr. Chairman, that the majority staff has worked in good faith with the minority staff. The more we do that, the better the process, the better the product is going to be. Let me comment very briefly on each of those 9 bills. H.R. 756, the National Pain Care Policy Act, enhances awareness of chronic pain with providers and the community. Chronic pain is an issue that many people suffer from. This bill would create an interagency coordinating committee to coordinate all the efforts within HHS and other federal agencies related to pain research. This effort, along with the efforts at the NIH via the Pain Consortium, will go a long way towards increasing research and awareness of chronic pain. H.R. 914, the Physician Workforce Enhancement Act of 2009, would assist small hospitals that serve rural or growing areas by providing them with the resources to establish a residency training program for certain high-need medical specialties. H.R. 20, the Melanie Blocker-Stokes Mom's Opportunity to Access Health Education Research and Support for Postpartum Depression Act, is a bill in itself, just in the naming of the act, Mr. Chairman. This one is from Representative Rush of Chicago, and I think it is a much-needed addition to our current law in this area. H.R. 577, I realize I've got three more, Mr. Chairman, and then I'll be quiet. The Vision Care Act of 2009 would ensure that children, especially low-income children, have access to vision screenings. We support this bill. H.R. 479, the Wakefield Act, reauthorizes the Emergency Medical Services for Children Act. This program seeks to ensure that hospital emergency departments have the ability to care for their young patients just as they do for their adult patients. We support this act also. The Early Hearing and Detection Intervention Act reauthorizes the newborn and infant screening program. I think this is a very important program, and we support that. H.R. 307, the Christopher and Dana Reeve Paralysis Act, delves into the issue of paralysis. This bill would authorize funding research on paralysis and research focusing on enhancing daily functions for persons with paralysis. We support the concept, but I believe this could be done within the NIH. There's two more bills, but we'll just simply say that we support H.R. 1253 and the Dextromethorphan Distribution Act of 2009, introduced by Congressman Upton.
Thank you, Mr. Barton.
Thank you.